Happy Twin Tuesday. Super excited to be coming with you guys today. I have Dawn with me.
Hey
girl. I'm super excited. Dawn's awesome. I've actually known her for quite some time now.
Yeah.
One of the best things I'm super excited about today is, of course, the combo is going to be great, right? But when Dawn was showing up, she was like, I want to sit down and talk about our intention of what we're going to talk about today. And if you follow me on social media, on just my personal side, you know that I'm very much into intentional living.
Yeah.
And what's your intention behind whatever you're doing that day, whether it's your workout, whether it's your food, going in and doing your job, because it makes a huge difference on shifting that mindset. Mm-hmm. So I think it's great that you wanted to set that intention for our live today. So
yeah, totally.
It means we care about you guys and we're bringing you the best info possible.
Yes.
Yay.
It's also a good segue too, because remember we were talking about when it comes to birth, not winging it.
Yes.
And I actually talk about birth intentions as well, right? Because then we're saying this ideally is how I want this to go. This is what I'm intending happens. But we're not also necessarily attached, because we all know we can have intentions and then sometimes it can
100%.
go a little bit a different direction.
Hey Rhonda,
Yeah.
hey girl, hey. Got the coffee on my shirt. Spilled coffee on myself earlier and she saw that. So I was like, of course, I have a live today, but we figured it out.
It's fine.
Yeah. All right, so as you guys know, Twin Tuesday, you did see the other week that Dr. Johanna popped back on for a little bit, and she'll be back in the office soon. But I wanted to reach out to other providers in the area so you know who's out there and who can support you. And today, like I said, we have Dawn, so I'm going to let Dawn tell you what she is and what she does.
What I am and what I do. So I'm Dawn Herring, and I'm always do I look here? Do I look at you?
Whatever you want.
Yeah, okay. And I am a childbirth educator, and I am a doula, and I call myself an empowerer of mamas.
Yes.
If there was one thing, that would be it. Mm-hmm. And I've been teaching for, it's over 2 years now in this beautiful community. Yeah. Doula a little less time because I was busy having babies. So being a birth doula, it's an on-call schedule, right? But doula for a little over a year, and I love to teach. It is completely and totally my jam. Yeah. You said that this morning. I'm it's my jam.
It's my jam, guys.
That's what I love.
And she has one of the best, the best childbirth education classes in Tampa Bay area. And she's really passionate and great at what she does. So you're going to see some of that come out, and I'm going to have her tell you her why in a second on why she is so passionate and great at what she does. But yeah, I just want to put that out there. She is great. She's the best one. So tell us a little bit though on why. Why do you get all jammed up to do it and excited, and what does that look like? So our people know. Yeah.
So I love to share this because I think it's important, and it's where this passion was seeded. So I actually personally chose to have my kiddos at a birth center. Mm-hmm. When I found out that I was pregnant, I just knew that for me, that was going to be the environment that felt right to me. I wanted to be able to be in control of my choices. I wanted an environment that was going to support and listen to me and support the natural birth process and my power and my innate ability to birth my sweet children.
Yeah.
And so I'm blessed and grateful that I was able to choose that location to have my kiddos. I sat through my own childbirth classes and remember being next to my husband and being oh my God, we are learning so much about each other.
Right.
Right?
Mm-hmm.
Seriously.
Yeah.
So much about each other. And even to the point that I joke about this, where we have this conversation about when moms are in labor. Sometimes if we were joking before, we're probably not going to joke very much anymore. We're going to get serious here. Mm-hmm. And I remember saying to my husband, you can't try and make me laugh when I'm in the middle of a contraction, right? And it was this whole thing, but it was so important for us to talk about, Mm-hmm. So when I sat in my birth classes, I was everyone should have access to this information.
Yep.
Because it was totally normalizing the birth process, what happens in birth, how to trust ourselves, how to listen to our bodies, how to move through what's happening, and also how to help empower our husbands or partners to be able to walk that with us, because they've never done it before.
I know.
How do you know how to support a laboring woman when you're what is going on here?
I agree.
Right?
Yes, that's what I tell my patients all the time. I'm you just, especially first time around, you just don't know. You haven't been through it.
No.
Yeah.
No. And you don't know what you don't know, right? So then you're, without a childbirth class, you're showing up to something that is going to shape, that I say it's the foundation of your family, and it's going to shape where I think every mom starts, like in motherhood. And so for me, I feel like when moms are educated and their partners, they've taken a birth class, they understand what's normal, they understand how to navigate it, they understand how to advocate for themselves. They're already starting out with a powerful foundation to meet that time. So that beginning motherhood, hopefully we're starting out on a stronger platform, right? Stronger foundation.
Which is great. So, well, one, I forgot what I was going to ask you right now. I know.
Yes.
Where do you mostly do your classes?
Yes, so I do teach in St. Pete, and I run a series at Thank You Mama. So that's been the one that I've been doing for over a couple of years. Yeah. It's a 5-class series, and it's over 10 weeks, and so they run consecutively. Yeah, so there's one in right now that is, we have 5 couples. It's a small group, which we really love, and then we have another one starting on November 7th. Yeah.
So when we were talking about our intention of talking about today, what we were going to share with you guys, we were, of course, getting all fired up and talking about our stuff.
Yes.
Tell them the stat of how many people normally take a childbirth education class, because I told her, I was like, I don't know the stat, but I know most of the patients that come in here that are having babies, I would say, I'm going to guess, but majority of them haven't taken or are not taking a childbirth education class.
Yeah.
And when
Yeah. I was going to say, like, I don't know, like, for whoever's watching, I'm like, maybe throw out a number. Like, I'd love to see.
Yeah. Like, Johanna, can you let me know what you think, or Peggy? Or I think Rhonda's on
what percentage do you think of expecting couples to take a childbirth class?
Throw it out there. No,
that's right. Let us see.
You can't. There's no penalty if you're wrong. We'll tell you the answer.
That's right. I personally think it's shocking.
I thought it was shocking.
I'm like, this is like something you'll never forget.
Yeah.
And it's a smaller. It's a crazy small number. Okay, 10%.
So we got a 10%. Okay. Anybody else? What do you think? How many couples take a childbirth education class before going into labor and dealing with that? Anybody? So we got a 10%.
We got a 10%. It actually is a little higher, so it's kind of encouraging. It's around 40%.
40. That's so
40
less than half.
%.
Oh, what did we say? We're on to 5%. Okay.
5%. Okay, yeah. So the statistics are actually better, right?
Yeah.
But it's still a small number when you figure you have 60% of women and their partners that are walking into labor without any training, right? Any I can't say any preparation, because the other thing I'll say is some, maybe doing like, consulting Dr. Google.
Oh, right? Dr. Google, guys, is scary.
It's a little scary.
Yeah.
Or listening to like what other people say, right? Because let's face it, everybody has stories about childbirth.
Everyone has stories, and they all like to share them as soon as you're pregnant.
They have opinions.
Yes.
There's like no filter.
No filter. They don't care about what you think.
No, it's like, oh, look, I see a belly, blah, 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 right? Whether you're ready for it
or not. Yeah.
So, then we're relying on kind of like what we've heard, or the good, the bad, and the ugly. A lot of times it's kind of the bad and the ugly.
Right.
Or we're strictly relying on what our care providers are suggesting is the path. Which, we were talking about this too. Here's the deal. Like, I think that first of all, I think pregnancy and birth are 2 of the most transformative experiences that we have as women and as humans.
Yep.
And I think it's an incredible opportunity to dig deep and get to know ourselves and understand our strength, right? And what we're capable of. And I think that if we're relying on what other people tell us to do, we're actually losing power. There's an opportunity to lose power, right? And so I think, as you were saying, like, what's my why? Like, I fully believe that women and their partners deserve to be informed, educated, and empowered in pregnancy and during labor, so that if and when choices need to be made, if you have birth preferences that are now taken a left from where you wanted to go right, you know how to navigate those with power. They may not be the ideal or what our preference was, but meeting those with an understanding and information is so much more, first and foremost, less anxiety ridden. Right? Mm-hmm. And allows us to at least navigate what's happening in a way that we feel like we made the choices that worked for us, versus being told or just not feeling like we had a say.
Yeah.
It's completely disempowering.
I agree with you, and that's what we talk to our patients about here, and that's why we try to get you guys to Dawn and to other people and promote doulas and all those things, because you're never going to be able to feel confident making the best choice for you and your family. If one, you just don't know, and two, like you're not empowered. And a lot of that, and I haven't been through the birth process, but with working with a bunch of women who have, that is a time to really connect to your power. It's a great time to reconnect and turn in and listen to your intuition and grow that. And if mainstream medical society, I think, throws you in this, they take you out of that power and they try to keep you over here, and they tell you all these other things. And then this is why we're having people women I see who are so scared to give birth, who have no idea that their bodies can actually do this. And they're looking up how many women give birth every single day. Yeah. Like, can I do this? Can I do this unmedicated if I want to? Any of these things. And it's a great time to turn in and listen and to try to, and I know it's hard, but kind of hush all the other things. And that's why you educate. You educate so you feel confident in your decisions that you're making, and that even if it doesn't go the way you want to, that you know your options and you feel comfortable within that.
That's right.
Yeah. So we had talked a little bit before we started recording too. I wanted you to talk about, do you think there's this like stigma or this idea of what a childbirth education class is and what's entailed in it, or is it only for like one type of parent or family?
I do. I think that I actually wrote an article about this, that doulas, aren't, I was going to title it, doulas aren't just for hippies.
I love that.
Right? But I think I got a little, SEO and keyword, and I was like, doulas aren't just for hospital births, for natural births.
Yeah.
But it's true. So doulas and childbirth educators are not just about natural or unmedicated births.
Right.
And I think that a lot of times I know, so we'll just stop there, right? Doulas and childbirth education, not just for natural births.
Not just for natural birth.
No. And I will tell you, like, I got asked this question because I named my business Empowered Births and Beginnings. And I got asked this question, very straight question about, so basically, I mean, when you say empowered births, like, doesn't that mean like natural? And I was like, actually, no. And I'm really glad that question was asked, because what I'm committed to, and I think the reason that my classes are as impactful as they are, is that it's helping moms and their partners navigate what an empowered birth looks like to them.
To them.
To you.
To you guys.
End of story. Like, an empowered birth may look like a natural birth to some mamas. An empowered birth may look like, I'm going to labor to this point, and I feel like for me, like, an epidural becomes part of the equation.
Sure.
Right? Or I'm intending an unmedicated birth, but I labored for 36 hours, and you know what? Mama needs a little break. And she gets an epidural, and that helps her get that break and continue to move through labor. We can be empowered in those choices, right?
100%.
So the scope of what I teach is really like the landscape and the different variations of birth. And my commitment is that everyone in my class listens for what resonates for them, right? And creates the preferences that work for them. And then again, if it goes a different direction, they understand like how best to navigate that with as much power as possible.
Are your classes just for first time?
No, and in fact, I love having moms and dads that have been in, like, that have had a baby that come in, because they bring a different level of like energy and experience to the group. And usually it's because their first experience wasn't as empowering as they were looking for, and so now they're like, you know what, we're going to do this a little bit differently. And that's a beautiful thing.
It is. Yeah. Growth mindset, guys, for sure. And if you've been through it, any experience before, it doesn't mean that we can't still learn and progress and do even better next time and heal maybe some old wounds and those type of things, which is pretty cool.
Yeah. I feel like I want to share this too, because this is another reason that I'm just like as passionate about this as possible. So I shared, like I said, that I wanted to have my kiddos at the birth center, and I was not flexible. So I was very much like, this is the plan, this is how it's going to go.
Sure.
Right? Like, really. Yeah. And I was fortunate enough to have both babies naturally, and I also was very fortunate that my children came flying out of me. I had very short labors, so I always say, like, I try and rub that off, like, on anybody that's in my space. Whether I can, really, I don't know, but I try. But I had 2 complications after both births, and I actually ended up with a hospital transfer both times. And it wasn't, it was a retained placenta, which is a small percentage of women that experience that, but that becomes an emergency situation.
Right.
We need that placenta to come out.
Yeah.
So at that point, if it doesn't, we have to go to the hospital to be monitored, etc. I was so attached to my unmedicated birth with my first baby that when we got to the hospital and it came time to help encourage my placenta to be removed from my body, they offered me medication and I said no. And I did it with no drugs because I was like, I am not losing this unmedicated birth. And you guys, I caused trauma to myself. Like trauma that was actually something I had to really work through and process through for a while. And so had I been flexible, had I met that change with an open mind and an open heart, I could have potentially avoided maybe some of the trauma. I think there would have been the disappointment of it going differently than what I thought. But I really, like, that was me. And so now I'm like, oh my goodness, like the biggest gift we can give ourselves is understanding like what our preferences and goals are, but being flexible, like a gymnast, because these babies, birth
is like
so unpredictable.
It's on its own plan. It's like, well, I mean, clearly it's Mother Nature. Like it's just, it doesn't, you can have the best plan, which is great. You should plan and look at all your options, but ultimately at the end of the day, what's going to happen is going to happen, and hopefully you're educated, you're making choices that feel good to you within those times that you have to maybe make one you didn't want to. Hopefully you have good people on your team. Well, not hopefully, just do it. Guys, you get to create your birth team. You get to make your choices. You hire your doctors. You hire all of us. You hire providers. They work for you. If you're not happy, find a new one.
That's exactly right. It starts in pregnancy with the team you have. Absolutely. If they're not working for you, we give you permission to find a new one.
100% permission to find a new one. Find somebody to support you.
That's it.
And you can have lots of people on your birth team, right?
The more the merrier, girl. Absolutely.
Midwife,
acupuncture, chiropractor.
That's
right. Childhood educator.
Massage. All of it. And it takes a village. It really does. Through pregnancy and postpartum, especially. There is a lot of care for the woman, and sometimes we try to forget about her, especially as soon as she brings baby earthside, because everybody's so focused on baby, and yes, baby's important, but what about mom?
Right.
So
transformative experience. Mama needs to be nurtured, supported, cared for.
And for a while, not just for a week.
No. No. Actually, I just was at a mom's group this morning, and the new, I think research or terminology is that the postpartum period isn't just the first 90 days. It's the first year. And frankly, we're all postpartum, after we have babies.
When you're postpartum, you are always postpartum.
That's right.
Once you're pregnant, you've always been pregnant at that point. You have experienced pregnancy, whatever the outcome is at the end, and you're always postpartum.
It's true.
It changes you.
That's right. Yep.
And that's awesome.
It is.
It's pretty magical.
It is.
So let's celebrate our moms instead. Please.
Totally. Let's support them, love on them, feed them,
Do their laundry, do their dishes. That's it. For life. Right, Johanna? For life?
For life. I love it.
She says. Awesome. Well, is there anything else you want to share? Where can they find you?
Okay, you're so awesome. So I am on Facebook. I'm not on Instagram yet, but that's next level. So Facebook is at Empowered Births and Beginnings.
And I did tag her in the thing, so you should be able to click on that pretty easily.
Yep. And so I also have all my classes listed there as events. So I have a new series, I think I mentioned, starting on November 7th. If your due date is earlier, or you have a question about how to get into classes, absolutely, message me on Facebook. My email is on my Facebook page as well. So I do the series of Thank You Mama. I also do private sessions too if need be, if dates don't work. I love those too, because I really get to it's I bring my doula vibe to the childbirth education. I always do, right? A little mini session, more personalized. So those are pretty awesome too. So
that's great. Awesome.
I'm so glad you had me on.
I'm so glad that you're here, that you shared your why and your experience. Like I said, the best childbirth education class in Tampa Bay. So make sure you click on her and follow her. And I hope you guys have a great Tuesday. Thanks for doing this with me today.
Thank you so much. All right, take care, guys.